Hello! Today we're going to walk you through a basic perioperative TEE exam, okay? So I'm placing my TEE probe down the mouth here, and I'm going for my first view, which will be my mid-esophageal 4-chamber view, okay? This is usually at 0 degrees, which I don't have here. 0 degrees, it should give you a view of the left ventricle and right ventricle, left atrium, right atrium, mitral valve, and tricuspid valve here. Just like that. From this view, I would then omniplane to about 90 degrees or 100 degrees, somewhere in there, to obtain my 2-chamber view. And in this view, you should only have the left atrium here, the left ventricle visible. You'll see the left atrial appendage on the right side of your screen, and on the left side you'll see the coronary sinus. This is a little bit more of a 2-chamber view here, actually. There you go. Notice how the mitral valve has the long leaflet on the right side. That's your anterior mitral valve leaflet. The shorter one on the left side, that's your posterior leaflet. There's your left atrial appendage kind of coming into view over here. From this view, the next sequence would be to dial out to 120, 130. On this mannequin, it is 140 degrees or more to your long axis view here. On this view, you should see the left ventricle, the left atrium, and the aortic valve. You'll notice 2 leaflets of the aortic valve. The bottom one, closer to the bottom of the screen, is your right coronary cusp. The one on the top is either the left or the non, you don't know. You'll see the mitral valve opening and closing to the left of the aortic valve. And you'll see another chamber down to the right of the left ventricle. That is the right ventricular outflow tract. Okay? From this view, what I do is I then I twist the whole probe to the right, like this. And then what I do is I dial back down towards 100 degrees. On this mannequin, you actually have to push in a little bit, or I'm sorry, to get the view. Dial down 90 degrees. And you get the bicable view. Now, unfortunately, this is the one view that I don't like as much on this mannequin because you don't see the left atrium as well. You see it kind of poking in, this little tiny bubble right there. You see some pulmonary veins coming right there, and you see the SVC heading down. If you look on the left side of the screen, you'll notice that off the screen actually is the IVC of the right atrium heading down. But it is a little more difficult view. You can push in from here to get a better view of what's below. And you can try to change your angle to a little higher if you had to. But not always the easiest one on the mannequin. This is probably one of the more difficult ones to get just right on the mannequin, I've noticed. But if you can get it to about here, that's pretty good. So this would give you a view of your intra-atrial septum, your left atrium on top of the right atrium there, SVC on the right side of the screen, IVC would be heading out the left side up the top over there. Okay? From here, I dial my omniplane down to about 45, 55 degrees, and now your aortic valve short axis comes into view. Right there. You should get this nice Mercedes-Benz kind of sign here. And I'm going to try to adjust this just a little better by antiflexing a little bit. Dial up a little bit here too. So on this view, I get it better for you. You have a view of your coronary cusps of your aortic valve. The one on the far right side is actually your left coronary cusp. The one down on the bottom is your right coronary cusp. And the one that the intra-atrial septum points to is your non-coronary cusp. That is your right atrium on the left side of the screen. On the right kind of top part of your screen is your left atrium. Okay? Now, just a slight adjustment, changing your omniplane angle up to 60 or more, and then turning just a little bit left with your TE probe, gives you the RV inflow-outflow view. In this view, you're focusing in on the tricuspid valve, which empties from the right atrium on the left side of your screen there, down into your right ventricle. And your pulmonary valve is the valve you see down on the lower right-hand part of your screen, which allows the blood flow into your pulmonary artery. This chamber down here right below the aortic valve is actually your right ventricle, and you're catching a view of the right ventricular free wall as it moves in and out. So it gives you an idea also of the right ventricular function in this view as well. Okay? From here, what I do is I dial all the way back down to 0. I keep that aortic valve kind of right in the middle there, and I pull up a little bit to see it better. Now what I do is I anteflex, and as I keep anteflexing, I start to pull out a little bit. Anteflexing hard, pulling out, that aortic valve still in the middle. And now what I have, right about there, is our ascending aortic short axis. Okay? So the ascending aorta is the circle right there in short axis. The next circle you see to the left of the screen from that is actually your superior vena cava. The vessel that you see right next to the ascending aorta is your main PA right here, which branches up and divides into your left PA and your right PA, pulmonary artery. From here, what I do is I keep the ascending aorta right in the middle of the screen, and then I dial my omniplane angle to 90 degrees. By doing this, I get a long axis of my ascending aorta. As you see down here, that's my aortic valve kind of popping into view. And I can see as much of the ascending aorta as I can by pulling up. And I think I have the lung fields turned off on this, but in a normal human patient, it would start to fade out because the left bronchus begin to cloud out that the ultrasound waves here. Now, right above the long axis of your ascending aorta, you have a short axis of your right pulmonary artery, right above that. Okay? This is a good view for checking to see how calcified the ascending aorta is before cannulation. Your surgeon will usually cannulate somewhere right about here. This is the anterior portion of the ascending aorta. You can look for plaques, dissections, that sort of thing. From here, I go release my grip on my anteflexion. I dial my omniplane back down to 0. I get back to my 4-chamber view, and I put my left ventricle right in the middle. Not over here, but right down the middle of the screen. And then I push in. As I push in, I keep that left ventricle right in the middle of the screen until now I have my transgastric mid-papillary view right there. Now, in a human being, sometimes you actually have to give a little bit of anteflexion to make that look a little better. Okay? But this is where I would do my preload assessment. I would get my end diastolic diameter here to see how much preload I have. I would look to see if the papillary muscles are being squeezed all the way down to where they're hitting each other. Give me an idea about stroke, about systemic vascular resistance, things like that. Okay? This gives you your view of your different coronary artery distribution. Of course, your LAD is down here, your RCA is up here, and your circumflex is more lateral down there. From here, you only have 2 more views to complete your 11 basic TE views. So what I do, right from here, I stay at 0 on my omniplane, and I twist my whole probe to the left 180 degrees. And as you rotate, you'll start to see the hemithorax on the left side. I start to pull out a little bit. And as I pull out, I'll see the descending aorta come into view in short axis right here. So once I start to see that, I'll take a picture here. I'll put color over it to see if there's any dissection or anything like that. The other thing I'll do for my last view is I'll dial out to 90 degrees by keeping this right in the middle, which twists the omniplane angle right around it, and I'll look at it in long axis. And again, I can put color flow across this and see if there's any kind of dissection or flow abnormalities that are causing turbulence. And that is your entire basic perioperative TEE exam.